So I have studied the impact of exposures such as natural disasters, violence, war, many other exposures that may have an effect on that pregnant person and then on that baby that is born months later. This paper is, in a way, an extension of a line of work that I started almost a decade ago. We witnessed the enormous toll the pandemic took on older adults, and we wondered, does this negative effect extend when the infection is experienced even before birth? And the reason to focus on preterm birth as a measure of infant health is because we know, based on past research, that preterm birth is the main determinant of infant mortality and morbidity in the United States. And so preterm birth is a very relevant measure of infant health because it really patterns the health and well-being of people during their entire lives. And there's also another very important and very troublesome correlation that is people with low income and racially minoritized groups are much more likely to experience preterm birth. This by far precedes the pandemic. This is not news. However, the impact of COVID only exacerbates these gaps. Disadvantaged pregnant persons were much more likely to have a COVID infection and therefore have negative birth health outcomes. Our finding that the negative impact of a COVID infection during pregnancy on preterm birth fully disappeared by 2022 was surprising. The finding that this negative impact of a COVID infection during pregnancy on preterm birth disappeared so much earlier in these communities where people were highly vaccinated was quite shocking. That was a clear message that supporting vaccination among the pregnant population is really relevant, and in particular among vulnerable groups. We were able to do this research because the state of California included information about the COVID status of every pregnant person that went to a facility to give birth. Today, we wouldn't be able to tell the extent to which a COVID infection matters for infant health and whether vaccination helps, because we wouldn't know who was infected. And we focus on COVID, but the implications of this research may extend to other viral infections too.